My name is Charlie Boggs, and this is my skills video for medication administration. To start, I have my printed out medication administration record, or MAR, for my patient, who is Millie Larson. Date of birth is January 1st, 1936. She has no known allergies and is due for 3 medications time now. The first medication that Mrs. Larson is due for is an oral tablet. It's Docusate 100 milligrams. I have here Docusate 100 milligrams, expiration 6/2024. This medication is good to give and it matches my MAR. The next medication that Ms. Larson is due for is insulin Lispro, 10 units. This is a subcutaneous injection with breakfast. I have here insulin Lispro. It is 100 units per milliliter in a 10 milliliter vial. So she's going to get 10 units, which equates to 0.1 milliliters. Expiration date for this is April 2031. She is good to have that medication and it matches my MAR. The third medication that Ms. Larson is due for is haloperidol, 2 milligrams intramuscular. I have here haloperidol. It is 5 milligrams per milliliter in a 1 milliliter vial. And I already calculated the math for this. She's gonna get 0.4 milliliters. Expiration date for this medication is 7/2031. So she is good to get this medication and it matches my MAR. The next thing I'm gonna do is prep my medications. So I'm going to wash my hands. I'm going to don clean gloves. We're going to begin my second check. The first medication is the Docusate 100 milligram oral tablet, expiration of 6/2024, and I have here Docusate 100 milligram tablet, so this matches. The next medication is the insulin Lispro. It's 10 units, subcutaneous. I have here insulin Lispro, 10 units, so we're going to go ahead and draw up those 10 units. When you're doing a subcutaneous injection, you want to make sure that your needle size is between a 25 and a 30 gauge, and that your length is between 3/8 of an inch to 1 inch. I have here a 29 gauge needle that is 1/2 inch long, so it's good for a subcutaneous injection. I'm going to draw up 0.1 milliliters of air. I'm going to inject that air into the vial and then draw 10 units or 0.1 milliliters of medication. I'm going to scoop and then label this syringe. All right, so I have here insulin Lispro 10 units and insulin Lispro 10 units. So this matches, and I have 10 units in this syringe. The next medication that I'm going to prep for Mrs. Larson is her haloperidol. This is an intramuscular injection. So for intramuscular injections, you want to make sure that your needle size is between 18 and 25 for the gauge, and between 5/8 to 1.5 inches long for the length. That is dependent on your patient's size and the size of the muscle that you're injecting. I have here a 23 gauge needle that is 1 inch long. We're going to go ahead and draw this medication up. She needs 2 milligrams. The math was 0.4 milliliters. So we're gonna draw 0.4 milliliters of air. Going to inject that into the vial and draw up 0.4 milliliters of medication. I'm going to scoop and label this medication. And then perform my second check. So haloperidol, 2 milligrams, 0.4 milliliters, and she needs haloperidol 2 milligrams, so this matches my MAR, and I have 0.4 milliliters in this syringe. My medications are prepped, so I'm now going to go into Mrs. Larson's room to administer the medications. I'm in my patient's room. I'm going to wash my hands. And I'm going to verify her name and date of birth. So, Mrs. Larson, can you tell me your full name and date of birth? I'm going to check what she says with her identification band and the MAR. So we have Millie Larson, January 1st, 1936, and Millie Larson, January 1st, 1936. So that matches. Mrs. Larson, do you have any allergies? She's going to tell me no, and I also have here no known allergies, so she is okay to get her medications. I'm going to don clean gloves. And the first medication that Miss Larson is going to get is her Docusate. So Mrs. Larson, the first medication is a stool softener. It's called Docusate. I'm going to do a third check. Docusate 100 milligrams, Docusate 100 milligrams, expiration 6/20/24. I'm going to put the medication into the cup. This is for to make your bowel movements easier to pass, and you're just going to swallow this pill. I have some water here for you as well. So I'll give her this medication, and then I'll just verify that the pill went down okay and that Miss Larson was able to swallow. Mrs. Larson, the next medication that I'm going to give to you is your insulin. For your type 1 diabetes, you need to have it with your breakfast. The last time we checked your sugar a few minutes ago, it was 169. So I'm going to do one more check here. Insulin Lispro 10 units, and I have insulin Lispro 10 units. The site we're going to do this, Miss Larson, is your the outer aspect of your upper right arm, because you had it in your left arm yesterday. So to prep the area, we're going to swab in, I'm going to find the subcutaneous tissue on her outer upper right arm and swab in a circle, starting inside and moving outwards. I'm going to let the area dry without blowing on it or fanning it. We're going to say that the area is now dry. I'm going to pinch the area. For sub-Qs, you want to inject between a 45 and a 90 degree angle. I'm going to do 90. Stabilize, inject your medication, remove, engage your safety cap. That goes in the sharps, and then we're going to apply some light pressure with some gauze. At this time, I would educate Miss Larson for the signs and symptoms of hypoglycemia and what to look out for. All right. The next medication that we're going to give to you, Mrs. Larson, is your haloperidol. This kind of helps calms your nerves, okay? This one goes into your muscle, and I'm going to do it in the deltoid muscle of your left arm. To find that, I would palpate for the acromion process on the upper arm. Let's say I found that here in this triangle is where we would administer the medication. We're going to go ahead and check one more time for our third check. This is haloperidol. I have 2 milligrams in this syringe, and she needs haloperidol 2 milligrams. So this is the acromion process. We're going to swab in a circular motion, starting inside and moving outwards. And then let that area dry, again without blowing on it or waving the area. For intramuscular injections, you want to do a 90-degree angle as well. And then I'm going to pull the skin taut, stabilize the needle, inject the medication, remove, engage the safety. That goes into the sharps. That completes the administration of Mrs. Larson's medications. I'm going to wash my hands. And then I'm going to document that I gave these medications. So we'll say 0830. And they were given by me. And then I will sign. And then I would ensure proper documentation.